Hello, and welcome to this UCL Lunch Hour lecture on managing COVID-19. How could we have done and do better? Our speaker today is Susan Mickey, who is Professor of Health Psychology and Director of the UCL Center for Behavior Change. And my name is Dr. Fabiana Lorencato. I'm also a behavioral scientist and work as the research lead at the Center for Behavior Change. It's my absolute pleasure to introduce Professor Susan Mickey, who I've had the honor of working with for numerous years. Susan's research focuses on behavior change in relation to health and the environment, how to understand it theoretically and apply theory to intervention development, evaluation, and implementation. Her research collaborates with many disciplines from information science to environmental science, computer scientists, and medicine, and covers population, organizational, and individual level interventions. Susan has published over 500 journal articles and several books, including the Behavior Change Wheel Guide to Designing Interventions. And she has recently been recognized as one of the most highly cited researchers in 2022 in the fields of psychiatry and psychology. Susan will speak today about applying behavior change to managing COVID-19, an area which she has contributed to heavily in recent years. Susan served as an expert advisor to the UK Government Scientific Advisory Group in Emergencies and its Behavioural Science subgroup. She has also participated in the Lancet COVID-19 Commission and is currently chair of and is currently chair of the World Health Organization Behavioural Insights and Technical Advisory Group. I could probably fill the remainder of this lecture talking about Susan's many accomplishments and contributions, so it's perhaps I best to leave it there and hand over to Susan. But before I do, I wanted to let you know that we will have time at the end of the lecture for questions and discussions, and that you can submit your questions at any point during the talk by going to Slido. So you actually type sli.do into your internet browser, and you will be prompted to enter an event code, which is hashtag COVID-19, all one word with a capital C. And that will enable you to post your questions there, which I will then moderate in the discussion section. So now I'll hand over to Susan for her talk. Thanks.
Thank you, Fabi, and I hope everybody can see the screen. Fabi mentioned the UCL Centre for Behaviour Change that she and I work at. And just to say something about what we do, we are researchers, consultants, trainers and practitioners. We work in a very cross-disciplinary way and also a very translational way. So what I'm going to talk about is part of my translational work. And we run many activities. So do go onto the website if you'd like to hear more. I think Fabi's already mentioned the various roles that I've played during the pandemic. So what I want to do in this talk is just say something about understanding behaviour in pandemics, and then something about behavioural science advice, and actually give a couple of examples. This is going to be quite a critical talk. An example of the government not following advice and an example of misusing behavioural science. And then I want to go on to just think about the nature of the science-policy relationship and translating scientific advice. So human behaviour, I think probably all of us are very aware of, is at the heart of causing and transmitting not only pandemic infections, but also responsible for the climate emergency, antimicrobial resistance, and many other threats and crises facing us. But they're also at the heart of preventing and getting out of them. And World Health Organization Director General, a couple of quotes from him, he incredibly supportive of our work and says, "I want to make behavioural insights an essential part of how we promote and ensure better health for all. And as the global public health leader, WHO cannot achieve its ambitious goal of transforming global health and the health of more than 7 billion people without a clear understanding of people's health-related behaviours." So that's my starting point. So behavioural science matters, and I say potentially because it depends on how it's communicated, how it's used, but potentially for enabling people to adhere to advice and rules, for developing the best policies, and also for implementing policies. They depend on human behaviour. And whose behaviours are we talking about? Often people think just in terms of citizens, the general population, but also think about the behaviour of health professionals, of employers, service and environmental planners, business leaders, policymakers at national and local level, politicians, and the list can go on. And this image here shows a kind of network that all these groups of people are interrelated, and really important to understand that wider system. So if we just think about systems, behaviour and pandemics here, key areas we're all very familiar with: the kind of personal protective behaviours, adherence to public health measures, and I'll talk a bit about the test, trace and isolate system, restrictions, including border controls and lockdowns and adhering to the various rules. And finally, vaccination is only as effective as the extent to which it's actually taken up. Very important to think about behaviour occurring in context. It's so different depending on the population, the particular local culture in any country, the particular culture within the world. And we know that transmission is greater, for example, in overcrowded housing, unventilated workplaces, so people's physical environments, also social environments, depending on people getting together in large events, talking or singing loudly. And then we've got these complex, often, systems of transmission. So obviously people travelling between communities, from one care home to another, for example, from hospital into care homes. We remember that only too well as quite a tragic. But also they can be very complex. So interactions between children and teachers, schools and households, then households and other sectors. So in order to enable behaviour change, we need to actually understand behaviour. And in order to do that, we need a model of behaviour. And what I'm going to present to you is probably the simplest yet a comprehensive model of behaviour. And it's called Combi. And this states that behaviour occurs as an interaction between three necessary conditions. So here's a little thought experiment for you. What needs to be in place for behaviour to happen? Something beginning with C, something beginning with O, and something beginning with M. Unless all these three things are in place, a behaviour won't happen. So here we go. First is capability. If people don't have the knowledge and skills, the psychological capability or the physical capability to enact a behaviour, it won't happen. On its own, it's not enough. One also needs to have the opportunity for any behaviour to occur. This is the physical opportunity, but also the social opportunity. And then finally, you can have all the capability and opportunities in the world, and we're probably all too familiar with this. And I'm sure you've all guessed what the M is. We also need to have motivation. So you need to be able to do it, you need to have the opportunity to do it, and you need to be motivated to do it. And indeed, in the jurisprudence system in law, these are things you need to prove that somebody committed a crime. And as you can see, there are various kinds of arrows linking these different aspects of behaviour, thinking, cognition, emotion, etc. And they are themselves in a system. So changing one thing can have knock-on effects on the other. And this is very useful when you're trying to enable behaviour change. I mentioned about the psychological or physical ability. When it comes to motivation, we have the reflective top-down mechanisms that activate or inhibit our behaviour, the kind of conscious decisions and choices we make. And I'm sure we think that that guides pretty much all of our behaviour, but actually we're wrong. A lot of our behaviour is a result of much more automatic mechanisms, more ancient bits of our brain. So our emotions, our habits, our drives, our impulses, really important to understand both of these. And then the opportunity. I mentioned the physical environment, but people's social environment are really important. And we're all very aware of what a difference it makes in terms of do you or do you not use a face mask in an indoor crowded place. For most people, it really depends on how many people around them are also doing the same behaviour. Now, if you want to find out more about this, because within this 40 minutes, I'm only really giving you headlines. The paper on the left published in Implementation Science about the Combi Model and something called the Behaviour Change Wheel that allows one to move from this model of behaviour to designing interventions and policies. is published open access in the journal Implementation Science. There's also a book. But I'd also really recommend, on the right hand here, a user-friendly guide that's available. Just go onto the Centre for Behaviour Change website, and there's one we were commissioned for local government, one for national government. I think the one for national government's the more up-to-date one, but they're both good. Okay, so back to COVID and the advice, scientific advice. I'm sure you're all aware of SAGE, the Scientific Advisory Group in Emergencies. And actually, I was on it in 2009 when it was a very small group of about 20 of us. And I set up the first behavioural group because I was the only behavioural and social scientist on there, but I managed to persuade them that behaviour is really important and needed its own group in addition to the modelling group and the clinical and virology group. So now it's large, very large and complex. I think there's over 100 people participated at some point in it. Has many, many groups and individuals feeding into it. And there's absolutely huge scientific talent on SAGE and on its subcommittees. Really impressive. The way it worked was in responsive mode. So we only worked to commissions from the government. We weren't able to say, we think we should advise on this. I would say another issue for the model was the word delays, sometimes weeks between us completing work and a report and it going up onto the website. And the whole translational pathway wasn't transparent. As a behavioural group, I think many of us saw a big discrepancy between what we're advising and what was coming from government. But who knows where the blocks were to that? Was it getting through? Was it getting through and being understood? Was it understood but wasn't welcome? We just don't know. The behavioural science group of SAGE published about 30 published reports, and up here is just the last one, which was about sustaining behaviours in the long term after rules were taken away. And in terms of things that I think we did that made some kind of positive impact, I think measures we judged to be harmful were limited or delayed. So, for example, the vaccine passports were more limited than originally conceived, and the monetary fines for self-isolation were delayed. We had more liberal social bubbles, I think, than might otherwise have been the case. There was a community champion programme that was designed and rolled by colleagues on our group and led to higher vaccine uptake amongst minoritised groups. And we did achieve some evaluations of behavioural interventions. So before I go on and give some criticisms, I did want to highlight some of the positives. So our general view was to increase adherence to public health measures. The government should take a positive approach, avoid blame, focus on enabling people rather than relying on enforcement. And again, thinking about this model, really thinking about motivation, thinking about giving people opportunities and ensuring they have the correct knowledge and skills. So some of the themes under capability, we focused on helping people identify and manage risky situations. And also we targeted intensive and tailored information where needed. With motivation, these were all advice. We advised giving positive feedback and emphasising that everyone has an important part to play. And in terms of opportunity, where restrictions were suggested, we suggested promoting and supporting positive alternative opportunities and help people to change their environments and form new social customs, and advice to target practical support where needed. Okay, so now I'm going to go on to a couple of areas where I think things could have been done better. So the first is test, trace and isolate. Now here's Tedros again, the Director General of the WHO, who really stressed the importance for countries to test, isolate and trace new cases to suppress the spread of the virus. This is really seen as the cornerstone of pandemic management, which is why I want to give it some attention here. Now, every single part of this depends on behaviour. Getting tested quickly and the right kind of test, registering your test results, providing information about your contacts, and isolating if one has symptoms or a positive result. All of these things are human behaviours. And modelers estimated that in order for this system to be effective, we need more than 80% adherence by the general population. Now, we were fortunate right from the beginning of the pandemic to have been awarded several years ago an NIHR grant for a nationwide weekly survey looking at behaviour and influences on behaviour. And this was a sleeping grant, so it meant that we had been able to get ethics approval and pilot things and keep it up to date, and therefore able to start, really very soon after the pandemic started. I don't know, we've published maybe 15, 20 papers from this survey. But here's what I want to talk about in relation to test, trace and isolate, which we published early on. So we had, for this data set, almost 54,000 symptomatic people. And what we found that people reported, fewer than 50% reported isolating. That's when they were symptomatic, and less than 30% reported requesting a test. So this was extremely concerning. We fed this information through into SAGE. We also, important to raise the question, well, is this because people aren't motivated, or is it because they don't have the opportunity? Now, Helen Ward and colleagues looked at this according to income levels and found that 87% were willing to self-isolate across all income levels. But those with the lowest household income were 3 times less likely to be able to self-isolate and 6 times less likely to be able to work from home. So this looks like it's much more of an opportunity than a motivational issue. And in our own data, we found that predictors were having a job with a low income and financial hardship. And the reasons that were given for not isolating were having caring responsibilities outside the home, needing to go out to get provisions, or insecure work, income or employment. And what did SAGE advise? They, and it's in red at the bottom here, they advised both providing enough financial support so that people were financially able to self-isolate, and also tangible non-financial support, practical support. Now, what happened? Unfortunately, they responded as if it was a problem of motivation rather than opportunity. So eventually, only £500 for a whole isolation period was offered, and this was less than the minimum wage. Only 8 of those were eligible, and of those who applied, only 30% received it. Also, very unfortunately, and we weren't consulted on this, a £10,000 fine was instituted if you were caught not isolating. Now, what do we think the unintended consequences of this might be? Any behavioural scientist could have said that given all the different behaviours I talked about, fewer people would get tested. Why would you get tested if you can't afford to stay at home? You certainly can't afford a £10,000 fine. Would you want to give your friends and family who are in similar situations, put them in a similar situation? You'd think fewer people would give their contacts, fewer people download the app, especially disadvantaged groups. And what we, as I said before, not only less than 30% said they got tested, but an evaluation of mass testing in Liverpool found that only 8% of disadvantaged communities got tested, even when this was local free testing on the doorstep. And these were some of the headlines at the time: just can't afford to self-isolate, too scared to get tested, etc. Okay, so I think you can see that there was a gap there between the kind of behavioural advice that was being given and the policies that we were seeing at the other end. Now I want to share with you an example of actually misusing behavioural science. And this is the idea of behavioural fatigue. If I was with you in person, I'd ask you to put up your hands to find out how many of you had heard about behavioural fatigue. So this I don't know where this came from, but anyway, back in March 2020, Chris Whitty said there is a risk that if we go too early, i.e. we lock down too early, people will understandably get fatigued and it will be difficult to sustain this over time. Now, the science of behaviour matters because this is Professor Neil Ferguson, who is on the UK SAGE modelling group, who estimated from their work that had we enforced UK lockdown even 1 week earlier, it could have saved 20,000 lives. Now, there was a lot of disquiet about this at the time. Here's an open letter signed by about 600 behavioural scientists. It didn't come my way, so presumably many, many more than that would have signed if they'd come across it. And a quote from their letter saying, if, quote, behavioural fatigue truly represents a key factor in the government's decision to delay high visibility interventions, we urge the government to share an adequate evidence base in support of that decision. If one is lacking, we urge the government to reconsider these decisions. Now, unfortunately, behavioural scientists were blamed for this delay. And Dominic Cummings, who I'm sure you all remember, when he was giving testimony to the one of the parliamentary select committees, attributed the delay to charlatan behavioural scientists, with his choice words, and said that we were saying the British public will not accept a lockdown or what was thought of as an East Asian style track and trace type system. Well, what did we actually say? Nobody said that. Behavioural science did not advise that people wouldn't accept restrictions. And you can see the evidence for that both in the SPI-B, the behavioural science minutes, and the SAGE minutes. So it just wasn't a behavioural science term. It was never discussed by our committee. There's no measure of this. It's not included in any theories. There's no evidence base on it. It was never mentioned by any of us in discussions or our reports or our advice. And indeed, myself and two other colleagues from UCL, Robert West and Nigel Harvey, wrote an article on this concept of fatigue. And fatigue is very different than motivation. You can be tired, but be highly motivated to do something, or you could be not at all tired and not at all motivated to do something. I don't know if I got that the right way around, but you know what I mean. You can be fatigued and not motivated, or not fatigued and motivated. And it does matter because these things are very different psychological entities with very different implications for how you then help manage a situation. And in fact, that week, the editor wrote an editorial to go along with it, saying a flawed idea central to a flawed pandemic response. So I know in the last bit of this talk, want to go on to think about what the responsibility of science should be. I think you've probably detected some degree of frustration. I mean, we were working evenings and weekends in addition to very busy day jobs. And on the behavioural science group, there was probably about 20 to 30 of us working full tilt to get these reports out. So quite demoralising when they didn't seem to be translating. Now, Philip Ball, who's a journalist, wrote this in The Guardian, imploring back in May 2021 that we shouldn't wait for the government inquiry, but UK scientists should conduct their own inquiry. And he says, if the science was not followed, scientists have a right and an obligation to ask why not. They should not passively resign themselves to the on-tap status assigned to them by Winston Churchill. Probably many of you remember the quote early on that the Prime Minister and others were very fond of, saying, oh, we're just following the science. But when it became clear, very, very evident that they weren't, that phrase got dropped. Now, I'm just going to give two different sort of concepts from two ex-chief, or I should say former government chief scientific advisors. So Sir David King here, who is very keen on being open and transparent about science, that scientific advisors should act as bridges between current science and the political system. So not just a one-way route, but a bridge. And the advisors are including advising government, but also informing the public. and I think very keen on the independence of that. And again, we remember from our screens the sight of Boris Johnson being flanked by a couple of scientists, and the questions raised about how independent all of that was. So Mark Walpert, on the other hand, is I think advocates a much clearer divide between scientists and policy, and a much more circumscribed role for scientists. So scientists advise, but politicians decide. That is fundamental. That almost the two should never meet, although not literally, but very different compartments. So what should the relationship be? And for decades now, I've been a formal and informal advisor to various aspects of government. So it's something I thought a lot about, but never so much as over this last 2 years. So on the one hand, scientists are not elected officials and are often unfamiliar with the policy context. On the other hand, evidence doesn't implement itself. There's a journal called Implementation Science. We know that if you just give a report to someone or just give guidelines without anything underpinning that or wrapped around it to help the translation of it into policy and practice, it doesn't happen, often doesn't happen. I also know policymakers often don't understand the scientific advice, nor how best to translate it. Because we weren't working with policymakers, we weren't having conversations with them even. It meant we don't know the extent to which they understood what we were saying. Were we expressing it in the best way? And then the whole translation of evidence, implementation of evidence are themselves the subject of scientific inquiry. So there's a whole knowledge and theoretical base about how to do this that could be drawn on for this purpose. So questions I'd asked: shouldn't social scientists be asked to advise on the translation process itself? And shouldn't scientists work in partnership with policymakers at all stages along the translational pathway? And I know when I think I've had most impact in terms of policy, it's been when I've had really good relationships and close working relationships with policymakers. So this mantra, scientists advise and politicians decide. Now, I think it was sometimes used to protect scientists from being blamed, but I think we do need to think about the principle of it, and I think it is an artificial divide. As I said, there's a translational pathway, there's a science of implementation, and from the journal here, they wrote an editorial about implementation science in the times of Covid-19 and made the obvious point: it is never sufficient to produce and disseminate information for changing behaviour, organisations and systems. And that's really all we did, was just provide and disseminate information. So I want to end on thinking about the many ways in which scientists can inform policy. There's not just the formal government structures, but there's individual relationships, which many of us had with individual politicians and local and national government, and people involved in the whole sort of policy landscape. There's use of press, broadcasting and social media, not always a happy place because things could often be misreported, or sometimes be misreported. And then ad hoc and informal groups and networks. So many of these. And I want to say something about independent SAGE, which I think is probably the most well known. Now, this was set up by Sir David King in early 2020, following the secrecy of SAGE, because at the beginning, the membership wasn't published, the minutes weren't published, the reports weren't published. And having worked with Blair and with Brown, and worked in a way in which he could be independent and speak directly to the public, he felt that this wasn't right. And so I was one of about a dozen originally scientists covering many different disciplines: public health, mathematical modelling, behavioural science, virology, epidemiology, etc. And we originally were just going to have one broadcast, but there were so many people watching it and such clamour for us to do more, that actually we've kept going on a weekly basis up until now. I think we'll probably end at the end of February. And this is a very complementary group to SAGE. So the aim is to put scientific evidence and debate into the public domain on the basis that openness and transparency leads to better understanding and better decision making. And also the view of those of us participating that it's the responsibility of scientists and those with specialist knowledge to engage with the public and policymakers in order to ensure that science benefits all of society. Now, this might be a discussion point, and I'd be interested in hearing your views. We were very agile, proactive, a small group. As I said, every Friday, 1 o'clock on YouTube, you can still watch it, although we're not meeting this Friday. We had these live stream briefings where we had every week a database update, invited guests on specialized topics, questions and answers with the public, politicians and the press. Especially at the beginning, politicians and the press were coming on very regularly. Now it's the public, but we have public questions every single week, and we've published more than 80 reports on the website. And because we're a small group and we could be proactive, we were able to really respond to all the emails we were getting, the questions that were coming through in terms of what was it people wanted to know about. There's a website, do go on it. There's a Twitter account, and yeah, every time, because it's quite exhausting, because we've got a behavioural group too that feeds into it, meets on a Tuesday evening. We meet on a Thursday evening to plan the Friday lunchtime. So that's all in addition to everything else we do. But every time we've said like we should stop, we look at the viewing figures, and we're still getting up to 20,000 people watching. But I think we will, when the crowd fund ceases at the end of February, we'll probably stop then unless there's a new crisis. But do go on the website, and all the reports and all the old broadcasts are all on there. So just to conclude, I think having the sort of concept of this hard border between science and policy, scientists and policymakers, can be unhelpful. And I think having a model where it's just, the chief scientific advisor, chief medical officer going and meeting with, prime minister, etc., and not having other interactions between scientists and policymakers is something that could be improved in the future. I think that engagement should be at all stages, right at the beginning when we're thinking about, what are the priorities, what do you need to know, and what areas of advice would you like, and kind of two-way iterative communication. That I think there was nobody studying what happened over this last period of SAGE. I mean, nobody knew it was going to go on for so long, but I think there should be somebody there who's actually looking at what happens to all those reports. Which committees do they go to? Are they discussed? Are they understood? Do people object to something there? Or is the reason for the translation of a lot of the advice because of a particular ideology of the government at the time? It would be good to know that, because a lot of taxpayers' money goes into this, a lot of scientific time goes into it, and it would be good to learn the lessons. And if we don't study something and you don't collect data on something, then all one's got is people's testimony, and would be so much better if there's somebody embedded looking at the discussions, the reports, etc., as it worked its way through government channels. And finally, I think scientists have a responsibility to not only engage with advising government, with society more broadly, including the public. And UCL's got an amazing tradition of doing this, and a wealth of ways in which it does engage with the public, of which this lecture is just but one. So in terms of the future, if I've got time, I think that we need to build, coordinate and use behavioural science expertise as we move forward to this long-term risk management approach, kind of taking the approach to managing COVID as we manage road safety. We don't just leave it to individuals to get on with it, because at the moment we still got hundreds of people dying, kind of every month. We've got lots of long COVID. I think it's 1.5 to 2 million people with long COVID. So the economy is actually suffering now because of the so many people are not in the workforce, as a result of long COVID, as a result of the burden on the NHS, meaning that there's a lot of people with ill health who are not working, who could be working. I think we should invest in achieving a better understanding of key behaviours across different contexts. There's a whole other talk I could give about the inequalities that have been exacerbated during COVID, partly a result of the nature of the virus and transmission, partly a result of government policy. And apply this understanding across society. So, risk-reducing behaviours is not just up to us as individuals, but the responsibility of all, including politicians, health professionals, scientists, and citizens. This was the final report, actually, that I led on, that is really advising government how to enable and support people to manage risk. Unfortunately, I can't see any of that actually put into practice. We've also published a summary of that in the British Journal of Health Psychology, but that's the URL if people are interested in that. Acknowledge amazing colleagues, both in SAGE and in Independent SAGE. It was an absolute privilege to work with them over this last 2 years, and also funders of my own research. And just if anybody is interested in finding out more about behavioural science and behaviour change more generally, we run a 4-week online course, and I think the next one's starting in January and February. But again, come to the Centre of Behaviour Change website, and then you'll find the details there. Thank you very much, and I hope I've left time for questions and a good discussion.
Thank you very much, Susan, for your excellent talk. And yes, you have left plenty of time for questions and discussions, which is great. Just as a reminder to everyone, if you have any questions for Susan, please enter them on Slido. So to submit a question on Slido, you just type sli.do into your browser and enter the event code, which is #COVID19, one word with a capital C. We do have a couple of questions, though, to get us started, Susan. So what do you think we should be doing now to minimize the chance of another wave and overburdening the NHS?
Well, I suppose it's who's the we, and I suppose it goes back to what I was saying about everybody having a responsibility. So there's the we, the government, there's we, for example, employers, there's we, all of us as individuals. But maybe if we start with us as individuals, we still have what, 1 in 40 or so people are infected, and we need to get that right down if we're going to prevent long COVID, which is really ruining a lot of lives, and really get on top of this. And I think the main things to think about is the fact that it's airborne. And the fact that it's transmitted in airborne fashion means the best way we can keep transmission down is to think about the indoor air quality. So wherever one can, ensure good ventilation, or if ventilation is not possible, HEPA filter. If you're in indoor space and the air quality is not good, and you can find out whether it's good or not by carbon dioxide monitors, to wear a mask, a face mask, and an FFP2 one, a well-fitting one. The surgical masks were okay at the beginning, when people think it's mainly droplets, but now with Omicron, it's really not useful. You have to have a mask that is really tight-fitting, a good seal all the way around. So those are things that that one can do. Obviously, if people are able to avoid enclosed spaces like some kinds of transport, that's all better. So walking and cycling and working from home if you can are all things that can help. Employers also, I think, really need to pay attention to indoor air quality. And in some countries, it's illegal to have poor air quality. We go into work during the day, or we go into recreational facilities or whatever, expecting not to be poisoned by the water we drink. We should expect not to be poisoned by the air we breathe, but that's not the case at the moment. So I think everybody, all employers and people with running different events with shared space should think about that. but it does need resources. It needs first of all to have the requirements, to have the rules. People need the infrastructure. They often need the finance to be able to do it. Then there needs to be inspection. I mean, there's been lots of contravention of health and safety over this last 2 years, but there's so little now in the way of inspection that nothing much is done about it. And as I say, in other countries, they have all these things in place, and so all of that's needed from employers. And then in terms of what the government can do and different kinds of authority, I think keeping keeping people aware that this continues to be a big problem, that the narrative that it's all over is such a dangerous one, or the narrative that it's only flu, again, such a dangerous one, because it's not helpful. And who knows what's going to happen in the future, but the main problem as well, or the two main problems about allowing these sort of levels to carry on, actually three main problems, the more I think about it, the more problems will be, is, as I said, people are getting sick, people are getting long-term disability, people are dying who don't need to, if that was lower. As I said, also, it takes up valuable NHS space. And so these awful waiting lists are not, could be reduced if COVID demand was reduced. And thirdly, the more that you have the virus going from one person to another, the more chance there is for new variants to emerge. The more variants that emerge, the more chance there is to be one that escapes vaccines. Already, these Omicron variants we have now are escaping vaccines more than they did before, but thank goodness vaccines are still having an effect. But that might not be the case. So for all those reasons, we really should be keeping it down. And it's not that difficult. I mean, personally, I always will wear a face mask in public transport, in shops, unless it's a small shop and the door's open, and will select where I go in terms of ventilation. Fingers crossed I haven't had it yet, but I think those are the kind of things we should still be doing now.
Great, thank you, Susan. So we've got a few questions coming in now. So quite a popular question has been, are there other countries we can learn from in terms of the government following the advice of behavioural scientists?
Yes, there are a lot of countries that did a lot better than the UK. I mean, unfortunately, UK's quite an outlier in how badly we did, which, given that we had such a great public health and NHS and science and technology record, is a huge shame. And I do hope the public inquiry does properly get to grips with that. But there's been a lot of reports written already. There were the countries that did the best were in Southeast Asia, where they've had experience of SARS and just put all these measures into place really quickly. So, South Korea and China and some of the other Southeast Asian states, also some of the Northern European countries did well. And those countries did well because they took a kind of all society view of things and sort of shared the responsibility. Everybody was doing their bit. They were very coordinated, and the test, trace and isolate system they got going extremely quickly and efficiently. And also, did have a view of, I mean, it was called different things, but some people call it zero COVID. I mean, it doesn't mean zero, but like driving it down, that is the ambition, rather than just accepting that we're going to live with it at a certain level. It's going to be interesting to see what China, what happens in China, because China's done incredibly well in terms of low death rates and low transmission. But by doing these local lockdowns, and at the moment they've got a big outbreak, I think about several thousand cases in Beijing. And once one gets that sort of level, it's difficult to do that. And Also, there's always a tension in any country about, how much do you reduce contact between people to drive it down. I mean, unfortunately, China, for various sort of cultural reasons, not a lot of the elderly people are vaccinated, so this is why they've had to keep going with this policy. So yeah, anyway, those are the kind of things that people do. The other thing is trust. I haven't mentioned this. Trust in government is absolutely huge, and there are, as a factor in terms of being associated with how well countries have done. And there are several studies now looking at different countries across the world and the level of trust. And where you have high trust in government, people adhere much more willingly, not surprisingly. And the adherence to these kind of rules, which are there to, prevent transmission, that did make a difference. So I think there's a lot to learn from trust, who's trusted, how trust comes into being, how trust is lost. I mean, if you look at the data, the UK government did have quite a high trust at the beginning, but lost it. And once you lose trust, it's actually very difficult to get it back again. Luckily, scientists, as well as obviously health professionals, were trusted, and there's been a high level of trust has been maintained. So I think very important to think about who's doing the communicating. Personally, I think if after the beginning part of this, if our leading scientists had been communicating directly with the public, there would have been more trust in what they were saying. But these are all things that really need to be looked at in detail.
Great, thank you. The next question is whether you have collected data and evidence to submit to the government inquiry on the handling of COVID-19.
So I was asked to make a submission, have made a submission, as I think a lot of people who are on SAGE and Independent SAGE have been asked to do, and answering various questions. So it wasn't a question of collecting data in order to do that. It's more a question of bringing together the evidence in order to answer the questions. So the first submission was really about looking at, the advice that was given, looking at our experiences, reflecting, thinking about, what worked, what didn't work so well. So I presume the next stage will be the inquiry will then look at people's submissions and ask people to come and give evidence. But as I said, it would have been so much better if the whole advisory process had been studied in itself. And for the added amount of investment that would have taken, I think that would have been hugely worth it.
Agreed. So we've got quite a few questions coming in now. So
Abby, I'm just going to shut a line because
because you're being blinded by the light there. Okay. I'll read the question out in the meantime. So was it difficult having a four-nation approach to managing the pandemic? So different areas of the UK having their own rules and managing that messaging?
It's difficult to know through which lens to answer that question. I certainly know colleagues who are advising in Scotland, advising the government in Scotland, and from their reports, it was a very different experience and situation. So there were much closer contact between the scientists, the policymakers, and indeed the politicians, all sitting around a table together. And I think much more sense that scientists had been heard. I'm not, I don't have any, I don't know about the Welsh or Northern Ireland situation. So that's one part of my answer. The other is, it wasn't just the four nations, but also we had a time when different regions were doing different things. And I think that one of the issues is to do with complexity. When things become very complex and different things are happening in different places and there's chopping and changing, then I think it becomes difficult for people to understand what's happening, why it's happening. Trust can go down, adherence goes down. Going back to that capability, which includes knowledge, and the relationship between that and motivation, and then people's behavior. And so the fact that the word, it's the same science, those four nations are not so different that there needs to be different recommendations, but it's an example where the science was being used and interpreted differently according to the politics of the situation. But of course, if people see something happening in one place and not another, they'll say, well, why is that? And it's quite undermining also the science, because they'll say, well, kind of, then what is the point of science if different things are happening in different places? So I think one of the, I would say one of the lessons we learned is there should be much more cohesion across the country. And it wasn't just the nations. If you remember, also there was, I think, Manchester, there were different regions where things were being done differently. Another thing that's incredibly important that wasn't done, it was done well right at the beginning and then not done, is to say not just what people should be doing, but why they should be doing that, giving a rationale so people understand the principles. What I think government should be much more focused on is really helping people to understand what's the nature of the virus, what's the nature of transmission, why is it we need to keep it down, how should we be doing that? And to this day, people are still not understanding some of the basics of transmission. And I think that if across the whole of the UK, there'd been some key messages, that were being given out, and people were being talked with, explained why different measures were being put in place, then I think there would have been much more trust and belief in it, because it did appear to become more politicized to some extent. The other thing that I didn't have time to talk about in this talk is the issue about, we're all in the same storm, but we're in different boats. UK is an incredibly varied country in terms of the population, really different communities. And, we know from behavioural science that it's really, really important how one communicates, who communicates, through what media do you communicate to different groups, and to make sure it's tailored to those groups. And that it isn't just a top-down communication, which is really what was happening. One of the things we said in so many reports that we just stopped saying it again, just refer back to our old reports, was listen to communities, consult with communities, engage with communities. This idea of co-production, co-creation of policies and strategies. And the reason for doing that is, firstly, you'll get much better policies and strategies because it'll be informed by people's lived experiences, which, policy makers and politicians, however well-meaning they are, don't have. And secondly, you'll have more buy-in. Those communities will feel part of the process. They will feel a responsibility for making things work if they've been part of developing those policies. So that's something that really, really should have been done. And I think it was done, maybe better in Wales and Scotland than it was in England.
Great, thank you. We have quite a few questions about perhaps changing the behavior of policymakers, and how you might approach that and engage with policymakers differently. So one question, for example, is perhaps understanding the behavior of policymakers in such a rapidly evolving situation is vital. What can we do to make them listen to behavioral scientists? And if you were in the same situation again for a future wave or another outbreak, how might you try to approach and engage with policymakers differently to make sure they listen?
Well, on the first couple, I'll have a go, and then you can remind me about the third if I don't answer that. Actually, we have the Centre for Behaviour Change runs an MSc in behaviour change, and one of the sessions I do with the students is all about working with policymakers and actually applying that Combi model to policymakers, and thinking about exactly that, enabling policymakers in terms of their thinking and their motivation and their behaviour. So several things I'd say. One is absolutely key to have good relationships, good rapport with policymakers. A second thing is to understand their incentives. their agendas, where they're coming from, what are they trying to achieve? Because unless you can be useful and helpful to them, why should they listen to you? So that's really important. And obviously that can come through doing background research on websites, talking to people who've worked with policymakers or politicians before, and also it grows through the relationship. The other thing is often, I mean, again, UCL Public Policy Unit here is fantastic and does lots of excellent enabling and training of researchers and academics to communicate with policymakers. But in general, we haven't been taught how to do it. And we talk with too much jargon, it's too complex. And so one of the things that's really important is to really simplify, not to dumb down, but to simplify the complexity of what we're saying. So, and that's why policymakers throughout government love that Combi model, because, you know, everybody can work with that. But the good thing about it is you start broad, you know, so you do think about opportunity as well as motivation, as well as capability. And that's not dumbed down, it's just simplified. I showed you a little way in which it gets more complicated. And then there's layers of making all of it much more complicated. So, you know, there's layers and layers of complexity going out, but it starts simple. And, you know, when we, you know, write, say, policy briefs, really brief, you know, policymakers don't have much time. And also they need to make decisions often quite quickly. So you need to make what you say or what you write really accessible. And one of the things as a result of NIHR Behavioural Science Policy Research Unit that both Fabi and I are involved with, is we wrote a guide to writing briefs for policymakers that was published, I think it was earlier this year. Again, that's free to download on the Centre for Behaviour Change website. So I think that maybe touched on the first couple of questions, but Fabi, did it answer the third one?
I think it did. And in the interest of time, I might just shift to one final question on a slightly different topic before we wrap up. So moving to talk about face masks. So the messaging on masks seems to have changed from protect yourself and others to protect yourself if you want to. So how do you, which is true, even on the tube at the moment, it says, wear a mask if it means you might feel more comfortable traveling these days. It's quite a shift. So how would you reverse this?
Gosh, that's so interesting. I think we can have a whole talk just on that. What we know, the evidence showed that one of the great motivators of people was about protecting their loved ones, the community, the NHS. That is a driver for people, because often people would think, I'm young, I'm healthy, I'm not at risk, but would actually, you know, kind of engage with certain behaviours like face masks because they recognise it will protect other people that are more vulnerable. And you don't know who's vulnerable, you don't know who's got what underlying conditions. So first of all, that's a huge shame that that's taken away. But it reflects, I would suggest, a sort of individualistic kind of ideology rather than a more collective one. That was another thing about the countries that did better. They have a much more collective basis of their society. The phrase, if you want to, now this again feels like libertarian, you know, like it's up to you, you know, it's a choice. I mean, kind of what's the point of saying that, really? I think that it's much better to give people the information. You know, there's now really good evidence that wearing face masks, whether it's in, you know, schools, whether it's in hospitals, other kinds of indoor spaces, massively reduces transmission. Give people that information. Give them the information about, if you're going to wear a face mask, this is the kind of face mask. And I would say, because we're still in a pandemic, we're still not out of the woods, encourage people to wear face masks. Now, just a small example of this is I was on a plane. I mean, I've stopped going on them for a long time, actually pre-pandemic, because of carbon emissions. So I only go when I really feel I have to. But I was wearing my face mask. The woman beside me looked at me and said, oh, do you want me to wear a face mask? And I said to her, only if you want to. With a nice smile, and she immediately put one on. Then she looked at me and she said, you know what? This is so sensible. She said, I'm actually going to go and visit my sister and her newborn baby. I should really, prevent myself getting sick too. I said, yeah. So that was just a little example. She had one in her bag. She's perfectly happy to wear it, but just hadn't got to that sort of level of thinking about it. So yeah, I think that's really unfortunate, that kind of wording, and that certainly did not come from any scientific advice, I can assure you.
Great. So we're at 2 o'clock, so unfortunately we don't have time for any more questions, but thank you so much to Susan for your excellent presentation and everyone for contributing those thoughtful questions. The last thing left for me to do is to thank the organizers for organizing this event, and also to signpost to the next lunch hour lecture, which is taking place on the 29th of November on the topic of whether girls' education, whether that's the answer to everything. So thank you very much once more to Susan and everyone for attending.
Pleasure. Thanks very much. Bye.